Let's settle for the details now. Now, in less than 24 hours, the parliamentary primaries of the new Patriotic Party. Attention will be focused on 100 constituencies as the party goes to the polls to elect parliamentary candidates for the 2020 elections. The anticipated keen contest in some 20 hotspots across the 16 regions of Ghana will be keen for both incumbents and those seeking to unseat them to take their quest to the delegates of the party. On the AM show today, Evans Nimaku, who is Director of Elections for the NPP, told Roland Walker all is set for a free and fair primaries for the governing party.
The party's arrangement is that because of the strict observance of COVID-19 protocols, instead of congregating at the constituency center, delegates will now congregate at the electoral area as defined by the Electoral Commission, so as to reduce the number and will not let it go beyond 100. And so we are observing all the protocols. Delegates will be given face masks. We are providing for each delegate. We're also making sure that alcohol-based sanitizers are provided. We are putting an arrangement to ensure that there's Veronica bucket with soaps attached for people to clean themselves out very well as they come to the voting center. We've had discussion with the Electoral Commission. Ballot papers have been dispatched to the regional EC offices for onward dispatchment to electoral areas, which are going to serve as the voting center. In terms of security, the party general secretary wrote to the police service, all issues relating to security will be managed by the Ghana Police Service, and we hope that they'll continue to do the good honor for us and help us organize a very successful conference in these areas. We have a total of 2,407 voting centers across the 101 constituencies. So far, discussions made, we expect that aspirants will comply with the party's constitution dictates, go along very well with the rules of engagement as stated in the rules governing the conduct of the primaries, and also bear in mind that the party is the supreme. And so they and their supporters have been advised. For our delegates, the polling station executives, electoral area coordinators, constituency executives, our council of elders and patrons who have the capacity to vote as delegates, they are not too much of a problem in situations like this, but sometimes the supporters who might go beyond our arrangement. So we are urging all party members that what we've done so far, they should crown it very well with this peaceful conduct, attitude, behavior on Saturday. Okay. This is the first time such serious political activity as elections is taking place in this era, COVID in Ghana. We are therefore expecting that we all observe strictly the protocols and also make sure that the ultimate is the victory for the new Patriotic Party. Yes, where people feel aggrieved, National Party has sent out national officers who will be responsible for each of the regions. So where there are grievances, these are individuals who step in.
Let's bring you some analysis on this. Remember, this is your election headquarters. This is where you need to stay for everything election, including the analysis as well. We have our men on the ground. Erastus Asaridonko joins us via Zoom. Okay, he's on live TVU from Kumasi. Erastus, thank you very much for joining us. We also have Richard Kojunyako join us via Zoom from the Central Region. And the man Rafiq Salam is also on Zoom with us. But I want to start with you, Erastus, because we are in Bantama right now. That is a hot seat and a place that will be keenly contested. It appears there are three things that will determine the race there. First, who has the resources, who has the backing of government, and then who is the man of the people. What is your reading of what's happening there?
Well, you will not be wrong to quote those as the determinant factors for the election at Bantama come Saturday, that's tomorrow. But then interestingly, yesterday there was another development. We had a section of the delegates converging at the old party office at Bantama and holding a press conference to declare and pledge their support for Asenso Boakye, who is the Deputy Chief of Staff. In fact, the reasons they are quoting for supporting him, I asked the same question, that you are supporting him because he's the darling boy of the president, because some largesse is being pushed from up seat down to you here. And they said no. They are claiming that though he doesn't have a budget, as compared to the MP for the area, he's been doing a lot for the constituency. They mentioned a particular area, Amanfrom, where they've never had a classroom block, and he's been able to construct a classroom block for them, and other things that he's been doing on the ground for the people of the area, and that is what is pushing them to support him. There are others who follow Honorable Ochema Boakye, and they think that, well, there's a history when it comes to the powers that be pushing candidates down their throat. And so they, this time around, want to show that they also have a choice and that nobody can be pushed down their throats, so to speak. And so these are some other factors that would determine tomorrow's ballot.
These delegates that you talk about, how many of them, and do you think that they would make any change as far as the election tomorrow is concerned?
Well, yesterday I counted about 40 of them, but then they are saying that there are many, and this is just a small representation of those who wanted to come for the press conference. And so they claim that majority of them this time around want Asenso Boakye to stay so that he could do more for the constituency. But there are others who also doubt that. In fact, followers of Ochema Boakye are claiming that the MP has been buying votes, allegations that they deny that he's been giving them money. But on the ground, we hear allegations of vote buying on both sides. Ochema Boakye's camp and Asenso Boakye's camp, there are allegations that both of them are trying to pay their way through. And of course, it runs through all the contests that we've seen in the Ashanti region, of people sharing money here and there, people giving TV sets, giving this, giving that. But nobody has evidence to that effect. But they are all allegations, though.
And the issue of votes buying is a regular feature in our elections, both at the party level and also at the national level. Erastus, I'll come to you so we look at Adansi Asokwa, because that's another hotspot that we need to look at quickly because of Katie Hammond. Let me go on to Zoom and speak to Richard Kojonyako. Richard, the Ewutu Senya seat has always been controversial, even at the national level. This time, we have George Anda, who is one of the few deputies who is being contested by Joseph Edu. Tell us what is happening there.
Well, as it stands, the incumbency advantage is being used by George Anda. The card he is using is that, well, he's the first timer who is being in government, and then he's been given the deputy ministerial position, and he wants them to give him another opportunity to do more. So that is clearly what George Anda, the Deputy Communication Minister, is seeking to use in this particular primary. But the Joseph Edu guy is also making serious inroads in the constituency. But people feel largely that Jajanda has done lots in the constituency and should be given another opportunity. When you interact with delegates, that seems to be the emerging factor that will determine who will win tomorrow's primaries.
How is the campaign going? Do you see a lot of resources being pushed down in a certain direction?
Yes, yes, that is true. And it is not only the Ewutu constituency, but it runs through all the constituencies as well. Let me run by you some of the constituencies in the central region. They have 12 now that will be going into the contest tomorrow. 7 are going unopposed. You have the likes of Kennedy Japan, you have Intim Fodjo, and you have the Ewutu Senya, the Mavis Howard Kumsin also going unopposed as well. But there are 12 that will be currently battling tomorrow. So we have the Cape Coast North, you know, Barbara Ashaisi is there, and she is pitching her might against three other people, Lawrence Ampa, and then two other people who have also been in the race in recent times. So you have
would you
London,
say that Barbara Asha AEC is as popular as she was 4 years ago when she came onto the scene? Would you say so?
Yes, because she's still popular among the people that are contesting, even though there is one particular person, Laurie Zampa, who is proving his mettle in this race. But if you interact with delegates, they feel that Barbara is also a first-timer, and she's been the deputy minister in two ministries, and if she's given the opportunity, she's going to do more in the constituency. So that is currently the card that is being played, but they feel that Barbara should have a slight edge over Lawrence Sampa, who is the closest contender in this.
Hold it there for me, Richard. Let's go to the Upper West region. The man, Rafiq Salam, joins us via Zoom. Rafiq, there are some hot spots also in your area. I am quite surprised that Anthony Abeifakabo is being contested, considering how he is popular in the town. We know his father is the overlord of the area. Is he still as popular? And do you see his contender, Joseph Donta, giving him a run for his money?
Yes, a lot of people are surprised that Anthony Abeifakabo is not going unopposed because considering the kind of development that he has taken to the people of the Laura constituency in terms of roads, in terms of health facilities, in terms of the infrastructure, talking about the Declare Bridge, which is something that is on the board for them. So many are really surprised about the contest. But you see, here in the Upper West region, there's a big rift, a big division in the MPP party. And so the man, Belson Donta, standing up against Anthony Abeifakabo, people think that he's been used as a proxy to fight political scores against Anthony Abeifakabo. And so this is the situation in the Laura constituency. And so, but from the look of things, people are seeing that Belson Donta is no match for Anthony Abeifakabo. Considering the results 4 or 5 years ago, this is the second time they are going to contest against each other. In 2015, Belson Donta contested against Anthony Abeifakabo. Out of the 600 votes, he got 63. He got 63. So Anthony Abeifakabo still looks like the more popular candidate because he is the incumbent. He has done a lot for the constituency, and they're yet to see anything from Belson Donta.
I'll come back to you, Rafiq. So we look at the other hotspots. I know that Ambrose Derry, for instance, is going unopposed. He will be declared, but there are other areas where you have some keen contests. I'll come to you, so we'll look at that. But let's go back to Kumasi. Erastus, I was talking about Adansi Asukwa because Katie Hammond had his lawyers write to the party to say that his contender is not qualified to be in that race with him. Not that he didn't want to, he wanted to run unopposed, but he says that through the ranks from the constituency all the way to the national level, his contender has been deemed unfit to be in that race. What happened with that letter that he wrote to the party requesting that he is withdrawn from the race?
Well, we've not had any information about the party taking a decision on the president of the National Union of Ghana Students, Samuel Benford Dakwa. We've not had any information to that effect. So far, they've disqualified about 10 of the contestants in the Ashanti region. We are having 15 going on opposed. He's not one of them. And so we've not had any information. If they had disqualified him or taken a decision on him, perhaps we have known by now. But I must say that Adansi Asukwa has been an interesting area to watch for a very long time. Remember, Katie Hammond in 2016 also wanted to go unopposed, and there were issues of agitations of people trying to kick him out because they feel he has not helped the constituency. This time around, he had wanted to go unopposed, but it did not work out. So until the party comes up with something, we still think that there's a contest over there.
Yes, to look out for tomorrow as we come with this comprehensive coverage here on your election headquarters. You can hear me. I just wanted to find out from you which other areas we should be looking out for, because Kumasi in itself, the Ashanti region, is quite a hotspot as far as this primaries is concerned, because if you want, these are safe seats for the NPP. And so once you win this, you know that you have a foot in parliament already. The rest is not so much of hard work. Which other areas should we be looking out for as we bring viewers and listeners a comprehensive coverage tomorrow on the election headquarters?
Right, and just as you said, it's true. And what has created so much interest in this parliamentary primaries and people gunning for it is because the moment you win, it's an automatic win for you in the main election. One area we can be sure of that you know, a lot of drama has gone on in there for some time now, in 2016 and even now, is the Menchia North constituency, where the incumbent Collins Owusu-Amankwa is being contested by Kwesi Kunadu. Kwesi Kunadu is a chartered accountant, and he hopes to give the MP a run for his money. But yesterday, we spoke with the MP, and he thinks that previously the issues that people were using against him and threatening his seat were roads. And in fact, when you looked at the Bokrom F-line road, for example, it's an area that attracted so much attention. People wanted him out because they felt he has not helped them when it comes to roads. But when you go to those areas, and especially from Airport Roundabout to Bokrom, the road has been asphalted. It's beautiful over there, and so it looks like the people have forgotten all about their woes. And so the MP thinks that it's not about just winning the seat. He wants to ship Kwesi Kunadu very well, to the extent of getting more than 70% of the votes in there. So that's one area that we also want to take a look at critically.
Sometimes we've seen quite a lot of drama in the Jobbing area, with some youth going on to invoke curses on the party leadership for disqualifying someone they see as a preferred candidate. We saw the action that the party took against them. How is the campaign looking like in that area?
Well, there is still tension within the party in that area. Remember, the party has taken a decision to suspend all 7 people who invoked the curses, and it has not gone down well with the people over there, the party folks, followers of that particular candidate. And so it's yet to be seen whether that will play any major role at all when it comes to tomorrow's ballot. You remember there were other invocation of curses in areas like Offenso North and all that. And so the party is currently deciding on suspending other people in those areas. There are 7 people who are waiting the decision of the disciplinary committee at Offenso, Asokwa as well. But Asokwa, we declared the MP to run unopposed, so it will not really affect anything over there. So yes, it's still yet to be seen what will happen over there, but campaign is still ongoing in those areas.
Erastus, I'll come to you to tell us what to expect tomorrow as you, Saeed, and the others lead the coverage in the Ashanti region. What viewers and listeners can expect from the team we have on the ground. But let me go to Richard Kojonyako. Richard, I see that Infantsiman is also another place we should be looking at. We have Echo Hayford and James Costa Brown also in that contest. And then when you go to the Dentra area, that's Upper Dentra East, we have Festus Ewa Kofi, Nana Amwako, Charles Afari, and there's one Dodo Richmond as well. Tell us about the competition in those areas.
So you see, there are interesting pairings, and that of Infantsiman, you know, Kokwansa Hayford is the incumbent member of parliament, and then someone is trying to challenge him. The person is seen as a community development expert. He's been in the constituency doing some NGO activities there, and people feel that he's likely to cause some upsets in the constituency. Remember, he started doing those works pre-2016, and then people see that he was doing that to warm himself up into the competition during this time where we have the seat. So he is likely, people feel that he's likely to snatch the seat from the incumbent. But what we have from the camp of the incumbent is that he's also done a lot. People feel that he's also a first timer. You know, remember that the Mfantsipang constituency is not a constituency that belongs to any of the political parties. It's been held by the NDC, it's been held by the NPP. And so going into this contest, people feel it is too close to call. The incumbent is likely to have a slight edge over the Kosa, who is challenging him. Let's go to the Aguna West constituency, where we have the Gender Minister also contesting, Cynthia Mamble Morrison also contesting. We have a former MP in the area who is also challenging this current Member of Parliament. And people feel that, well, Cynthia has had some issues in the constituency, but the odds favor Cynthia as well. Let's go to the Upper Dintra East constituency, where Festus and then incumbent Nana Amakon are also contesting. It's going to be a very hotly contested seat come tomorrow, because Nana Amakon has held the seat for a very long time, and people feel that he's been there and they do not really see what exactly he's been doing, even though they feel that he's done his bit, and so they would want someone else to also take the mantle away from him. You go to Isikumo Dobimbrakwa, and the same thing, 5 people are up for that slot over there, and it's going to be pretty interesting come tomorrow.
Richard Kojunako, you mentioned a very important point, which is the fact that some of the seats, a lot of the seats are not safe seats for the NPP. In fact, the central region has always been a swing region, and so it is very important that whoever is selected or elected to represent the parties, both the governing party and opposition, has quite some good support, because what happens usually is that once there's some disenchantment at the base, it then tends to affect the party in terms of maintaining the seat. Generally in the central region, do you see that happening?
There are some of the seats that are likely to go back to the NDC even after this contest, and there are some that are going to be still held by the NPP, because whoever wins is not a safe seat. A lot of the seats along the coastal belt, because of the fishing activities, and whoever wins those areas, they expect that the fishermen will be better off in their activities, in their businesses and the other things. So if they feel that, oh, this person came and did not help the cause of the fishermen and other development areas in that place, then you will go. So a lot of the seats have not been held solely by the MPP or solely by the NDC. It depends on a lot of factors. They look at what you have brought on board and what you stand to bring on board. And so if you win the central region, it's not a safe seat like we have in the Ashanti region, where, I mean, after winning the primary, then you have 1 foot in parliament. But this one, you have to really work, especially if you go to the Himalaya Dintra area. There is a problem where Bright Rekubobe, the Deputy Employment and Labor Relations Minister, is contesting a former constituency executive. I mean, there is a sharp division among the people of Dintra and among the people of Himan, and that is likely to affect. So if these cracks are not managed very well, even after the primaries, then there is going to be a problem, because the NDC has furthered a candidate in the person of the former member of parliament for the same constituency, and so he is seeking a comeback from these places. So when you win, it's the likelihood of you winning the main elections is also high, because it depends on what you bring on board. The Etimukwa constituency is another key constituency to watch, because there's likely to be an upset. Abraham Jumaudum has held the seat for 4 years. Apart from Abraham Jumaudum, no member of parliament from the MPP has won that seat before. And so there is a lecturer who is from the University of Education, Winneba, who is Professor Usu, who is trying to, this is not the first time he's been in the contest. He contested him and lost in the 2016 primaries. But this time, people are saying
there's a place to look out for, Richard. We're running out of time on this one, but I know that you're leading the team to bring us comprehensive coverage here on the election headquarters, and we trust that, as always, you bring us up to speed with whatever is happening in the region. Let me wrap up with Rafiq Salam as well, who is on Zoom. Rafiq, tell us about what to expect briefly in 30 seconds from the Upper West region as we bring that coverage to viewers and listeners tomorrow.
The Upper West region, there are places that to look up to is the Sisala East constituency, where Ridwan Abbas Dauda, he is the incumbent MP, will place his strength against the Deputy Upper West Region Minister Amidu Chine Saku. And also, there's also another two horses race in the Sisala West constituency.
Unfortunately, we seem to have lost Rafiq Salam there via Zoom. Apologies for that, but definitely the man Rafiq Salam, as you always know, is everywhere in the Upper West region. Let's go to Erastus and wrap up with him. Erastus, tell us about tomorrow. All eyes will be there in that region. What should we expect from the team?
So today we are putting our gadgets together. We have TVU with us, so definitely viewers will have live feeds from wherever drama or action is happening on the ground. We divided ourselves into about 6 teams, so we are covering every part, including all the hotspots and all the areas that you want to hear something from. So we'll start very early in the morning, and various teams on the ground will be feeding you with up-to-the-minute information.
Thank you very much for bringing us up to speed with what's happening in the Ashanti region. And of course, this is your election headquarters. Thanks for staying with us. Let's do some other stories away from elections. And no more talk. We want action. This is the unanimous call by staff of the Pantan Hospital here in Accra as repeated appeals for protection of encroachment and safety concerns force them to withdraw their services. The staff say no longer feel safe working in an environment where gunshots and physical attacks are rampant. Komladon visited the hospital Thursday and reports nobody was spared as pregnant women attending antenatal at the hospital's maternity block were turned away.
Protests, press conferences, sit-down strikes. Staff of a Pantai hospital since 2017 have demanded governmental intervention to address the problem of encroachers on the hospital land. According to them, the activities of land guards amidst gunshots, attacks on members, and invasion of a facility premises means they no longer have a safe place to work.
Here we are, nothing has changed. It's been 3 years, so no one can tell us to keep waiting.
The situation demanded the intervention of health authorities, with Minister Kweku Agyeman-Manu promising to address the matter in 2017.
We have seen what is going on here. The developments apparently encroaching on Pantan Hospital's lands, blocking the whole facade of the huge facility that we have here. And I don't think that is the best. Luckily, we met the main person who claims to own the land with his documentation and the court judgment. And it's like he claiming that he has rightful title to the land and therefore he cannot abandon his own property for the sake of the hospital. Luckily, after engaging with him, he seems to have accepted my proposal that he's going to hold on with developments temporarily, and I've stressed temporarily, until we engage properly later after.
But 3 years on, the situation appears worse. Local Ghana Medical Association Secretary Dr. Alex Ansan-Owusu says enough is enough and only action will get them to back down.
It appears our leaders are completely listless, apathetic. They aren't concerned about what is happening. Because you can't wait for all this period. We said the first letter went on the 22nd of May. Here we are, 18th of June, and nothing has happened. 3 years ago, this started. They told us that they were going to reacquire the land, but here we are, nothing has changed. It's been 3 years, so no one can tell us to keep waiting.
He said the staff have taken the decision to stay away from work and only the following would appease them.
Now we are saying that we won't take any worse. We want to see action. We want to see a wall being put up. We want to have a security post here so that we can feel safe. If they won't protect the land, fine. But before we work, we must get some level of safety. Then we can resume work. We won't settle for worse. None of us was happy to see the clients being turned away. People coming all the way from Eastern region, Central region. You know, this facility provides mental health care for people from all over West Africa, not just Ghana, not just Accra. We provide services to a vast range of people.
On the first day of a strike, patients were turned away. Not even pregnant women on antenatal visits were spared. I brought my wife for antenatal care, but we have been told the doctors and nurses are on strike. The workers, clad in red arm and headbands, say it is time to take matters into their own hands and demand their due.
We have COVID-19 patients on our wards. Our facility is the only facility equipped in Ghana to take care of COVID-19 patients who have mental illness. If they are still not concerned and it gets to that point, we won't see anyone. They can be there. We don't have the power to discharge them, but we won't see them. That we can do because we are not safe. We want them to come. And we want them to come with action, not with words. We are not satisfied with what is happening. It is not fair to us to be put here, and it's been 3 weeks or 4 weeks now. We've gone to have an encounter with the ministries and nothing is happening.
Let's go to Zoom now. Dr. Alex Ansah, who is the GMA Secretary for the Pantan Hospital. He joins us. Thank you very much for your time, sir. I'm wondering, since yesterday you took that action, has anything changed?
No, nothing has changed. So yesterday we had a meeting with the Mental Health Board. So they came over and then we had a dialogue. They wanted to find out what was happening, what was going to get us to work. Our response was no different from what we said earlier. We want to have a sense of security. We want a wall around the hospital and we want a security post. As soon as that is started, we will get back to work. Nobody will ask us to go back to work.
Strike continues unabated. Despite that, we have a lot of mentally ill people, pregnant women being turned away and all of that. That is not enough to get you back to work?
So like I said in the interview, we don't enjoy seeing people being turned away. No, we don't. We love what we do. But this is not just about us. It's about the safety of the people we are seeing as well. If the environment isn't safe, it isn't safe for the staff and also the clients we see. So we are hoping that the wall will be built and everyone that comes into the institution will feel safe. You can cast your mind on all the other hospitals you have around. How many of them have not got walls around them? And looking at the kind of people we see over here, is it too much to demand that we get a wall around the hospital? I don't think so. So we want to be safe. We want our clients to be safe. And when that is done, we'll be very happy to go back to work.
Thank you very much, Dr. Alex Ansah Owusu. He is the GMA Secretary for the Pantan Hospital. We'll be following up on this and we'll bring you more in our subsequent bulletins. This situation has persisted for a while. Now, let's do some other stories. Now, Ghana's Food and Drugs Authority says dexamethasone, a steroid drug that British medical scientists have hailed as a breakthrough in the fight against coronavirus, should be used with caution and not abused. The Food and Drugs Authority, in a statement, said dexamethasone is a corticosteroid medicine that can be only prescribed by a licensed medical practitioner for specific indications, warning that the drug has some serious side effects. We have on the line George Sabla, who is head of safety monitoring at the FDA. And so tell us about the side effects of this drug, for which reason you are saying that we should be careful in its use. Well, we seem not to have George Sabla on the line. We'll raise him and we'll bring you some more education on this drug, because already we understand that people are moving to the pharmacy shops to get them for personal use, but we are told that it's not safe. Let's do some politics. We'll return to this shortly. Former President John Mahama has described government's handling of the country's COVID-19 cases as chaotic. According to him, the astronomical increase in the country's cases is a reflection of how government has tackled the pandemic. Addressing Ghanaians in an address live on Facebook, the former president noted the government has been very inefficient, adding government's failure to listen to the advice from stakeholders is a cause for concern and also accounting for the surge in the numbers.
I wish to emphasize that the present situation we are grappling with could have been avoided if suggestions offered by well-meaning Ghanaians, including myself, were heeded by government. The Akufo-Addo administration refused to listen to calls to include assembly members and traditional leaders in public education about the disease, in distribution of COVID relief items, and in contact tracing and surveillance. The result has been the disorderly and chaotic distribution of food that caused the lifting of the lockdown. Public education has also been abysmal, and understanding of the transmission of the virus is low. Messages in our major local languages are very few or non-existent in many cases. This is reflected in the total absence of physical distancing in our public places, such as our markets and transport terminals. Involvement of traditional rulers in guiding surveillance and contact tracing would have delivered positive outcomes because they know their communities well. The consequence of government's decisions born out of short-term political considerations instead of the science of the pandemic has been the rising number of COVID-19 infections and the resultant deaths we're seeing today. From 2 confirmed cases on March 12th, that rose quickly to 8,548 on 1st June. Today, 17 days later, we have 12,590 confirmed cases and 66 deaths. Reports that isolation and treatment centers are full make the situation all the more dire. While government keeps priding itself with success in testing and has attributed the high rate of infection to the increasing number of tests being conducted, many have expressed skepticism about the accuracy of government's COVID statistics and gone as far as accusing the authorities of massaging the figures. It is recommended by international health experts that as countries start to ease restrictions, it is necessary to expand testing in order to understand the trajectory of the virus. Unfortunately, a strange directive has popped up, issued by the Central Regional Director of Medical Services, requesting all districts and facilities in the region to halt mass testing and test only in conditions when a patient comes in with suspected symptoms of the disease. This has been interpreted by many as an attempt by government to restrict testing in order to show a slower rate of infection. We all have a part to play, all of us, towards ensuring that we protect ourselves and our family and our colleagues from infection. But it is the responsibility of government more than any other to ensure that our management of the COVID virus is transparent, is people-centered, and is based on the best scientific advice and practice. My brothers and sisters, health is a human right. The outbreak of coronavirus has shown that a strong healthcare system is vital for any country.
Former President John Mahama there. Let's return to our earlier story where the FDA is warning about the use of dexamethasone, which British medical scientists is hailing as a good drug for the treatment of COVID-19. We're joined on the phone by George Sabla. He's the head of safety monitoring of the FDA. Thank you very much, sir, for your time here on News Desk. You're saying that we shouldn't use this because it has side effects. What exactly are these? The effects of using dexamethasone without prescription?
Good morning, and good morning to your listeners. What the FDA is not saying dexamethasone is a bad drug, but we are just trying to caution the general public that abuse of dexamethasone can be dangerous. First of all, let me start by saying that
then we break for business.
We all agree that COVID-19 is a new disease, and all over the world, scientists are fighting and working around the clock to find effective treatment or prevention for this disease. And this includes use of older medicines, and dexamethasone happens to be one of them. And secondly, dexamethasone has been around for decades, since the 1960s, and it's been used for a number of conditions, including asthma, arthritis, and so many other conditions. So, and dexamethasone belongs to a family of drugs called corticosteroids. And these drugs work by suppressing excessive immune reaction and by reducing inflammation. And dexamethasone is used in COVID-19 is because in COVID-19, and patients, in particular patients who are critically ill and requiring oxygen or ventilators, the immune system goes into overdrive. And what's the immune system is designed by God to protect us against disease. So in case you are infected by a bacteria or a virus, the immune system works in such a way that it fights the bacteria or the virus. But in COVID-19, in the process of fighting the disease, the immune system goes into overdrive. So the reaction becomes excessive. So dexamethasone works by suppressing the immune system. So that's what dexamethasone does. And like I told you earlier on, that dexamethasone belongs to a group of drugs called corticosteroids. So there are several other drugs in the same family. So what the FDA is saying is that dexamethasone is not to be used for prevention or treatment of COVID-19 by patients at home. What is happening is that in the British study, the study found out that dexamethasone is able to reduce death in patients who are on ventilators and who needs oxygen. So what it means is that it's not every patient who need dexamethasone.
Definitely.
So that's what we should do.
And I'm just wondering, because of what appears to be a rush by Ghanaians to get this drug, like we saw with chloroquine and with the vitamin C when it came up as part of the treatment for COVID-19, is the FDA doing anything to check the purchase of the drug on the market, over the counter? Is there anything you can do if you're not doing anything already?
Yeah, so the press release by the FDA is the first step. So we are informing the general public that this drug is already available, and it's a prescription drug that is used for the condition that I've already stated earlier. And it's a prescription-only medicine, so you can only buy it when you have a valid prescription for a licensed medical practitioner. You don't go and buy it over the counter. And if you look at the FDA statement, I told you earlier that dexamethasone belongs to a family of drugs. So there are other drugs that are used for people who are on ventilators and who are infected with COVID-19. So the drug is available in this country for treatment of patients who need ventilators and who are on oxygen.
Okay.
So the drug only prevents death in patients who are on ventilators and oxygen, and not moderately ill or patients who are asymptomatic.
Very well. Mr. Sabla, thank you very much for your time here on News Desk. I guess this has gone out well to all who are watching. You don't have to get dexamethasone if you're not on treatment. In fact, it is a prescription drug medicine, and you should be careful because it reduces the immune system as well, especially if you're not infected with COVID-19. Now, we're taking a break here on News Desk. When we return, we'll hear from the coalition of people affected by the banking collapse while expressing disappointment with government's handling of that situation so far. Stay with us.